is Mauricio Consulter. I'm a doctor licensed in Illinois, and I've been practicing medicine since the year 2000. And we've been successful in the community. We've been serving for internal medicine, geriatrics, and palliative medicine. And we always dealt with very complicated patients, and we work with cancer patients. And then 2015, that's when we started working with the medical cannabis. That was the beginning of our journey with the revolution of the medical marijuana. When it came, the law got approved in 2015 for the medical card. We had the patients already. Okay, we started with the cancer patients and the terminal patients, and we were having interesting results with cancer because the cancer patients using marijuana, they were having a better life when they were going through chemotherapy. Their transition was really good, actually, working their anxiety. And all of a sudden, the family members from the cancer patients started bringing us other patients. And I remember my first patient outside of the oncology world was fibromyalgia. And then afterwards was a snowball effect. We have all sorts of patients from Crohn's, rheumatoid arthritis, migraines now, and obviously above it all, it was post-traumatic stress disorder. So here we are, and we serve several patients, and we've been following a lot of them. And we have what we call cannabis-based internal medicine clinic, where we are actually doing measurements in their blood pressure and diabetes and cholesterol before and after they start the marijuana. And it has been a blessing. So I have only great things to say at this point, what marijuana is doing to our patient population in our community. Marijuana overdose is something that would be extremely rare, but people, if they overdo it, they can have amazing side effects from it, such as people can have severe anxiety, they can hallucinate and go through a bad place, what we call a bad trip, and they might have no assistance to get out of it, and these folks might end up in the emergency room. Tachycardia is one of the symptoms that happens, that you can speed up your heart rate. And then we always prevent folks who have atrial fibrillation or cardiac disease. They have to go slow, and then we cannot recommend marijuana for them if their heart rate is well controlled. So those are my biggest concerns. Also, teenagers. We want the teenagers who qualify for the medical cannabis to start with lower dose of THC with a predominance of CBD, because their brain is still developing. Okay, so if you start feeling sick at home and you think you're overly high or overly anxious, before you go to the emergency room, you should first of all, hydrate yourself, lay down comfortably, play like a nice soft music, work in your breathing, and just let it go. Okay, this is a transitional period, and it goes fast. So usually happens with the folks who have no experience and their endocannabinoid system are not ready for a high dose of THC. So you have to start slow, and you have to build up your endocannabinoid system so you go to a comfort place and you won't have this kind of side effects. If you're a resident of the state of Illinois and you have a qualifying condition, you should have a medical card. You're going to be in a medical monitoring system where you're going to have access to a doctor or a nurse or a staff who are well trained and prepared to guide you through it. And they will have follow-ups with you, and you can access them afterwards just like any other doctor. I mean, my follow-up patients, most of them, It's about their medication interactions, if they're doing things right, and you want to be part of it. There's also financial incentive because your taxation on the medical cannabis card is lower, significantly lower in the state of Illinois, so that helps patients, and I think that's fair because if people have comorbidities, they shouldn't pay more money like just recreational. So yes, the cannabis law is built in Illinois to help patients be part of the program and their families and improve. We expand beyond cannabis. We start doing what we call ketamine infusion, and ketamine is an anesthetic. It was developed in the 60s. It turns out the ketamine works in receptors where it causes dissociation of your consciousness. It works similar to psychedelics, actually in similar receptors. And this is a therapy for the patients who fail traditional medicine, like such as SRIs, patients who have history of suicidal ideation, suicide attempts in the past, and also folks with history of PTSD who are not responding to cannabis with traditional medication. We do infusions, and it's very, very promising because the response is very fast. You're talking about a matter of minutes to hours, and people ready, they feel the difference in their mind of burden of having severe depression or hard to treat depression or refractory treatment depression. And they come here and it's always an amazing experience. People cry, people laugh, people hug us because it's a fantastic experience. It's a novel therapy here in Illinois, but it was in other states, but it's something that is expanding the nation. And we also touching patients now with cancer, with severe fibromyalgia as well, intractable pain, and we've been successful. So you should look into it in terms of if you have a medical condition that is not responding to previous therapy, okay? And I would like to let the Chicago High Tour folks that they're gonna have a very good discount for their clients here in our office. And we're gonna have our fun on for you guys anytime you want. You can call us during the tours, and we're here to answer you guys. Okay? Right, so here's the infusion pump, just like the ones you see in the hospitals and the emergency rooms. Okay, here is another, it's an equipment that is gonna measure blood pressure, your pulse, and your oxygenation levels in your blood as well. And here is an EKG monitor in case you need to monitor the patients.